Hey guys, Rick Wilkinson here from The Motivated Paramedic. So today we're going to talk about those out of control, aggressive, sometimes dangerous patients that you have to sedate. Now we know there's lots of medications on the market, from Ativan to Valium to Versed to ketamine. Today I'm going to talk about specifically about ketamine. Now, as always, follow your local protocols. I'm going to use two references. One is the paramedic flash card most of us see on social media, and I'm also going to post another one right up here that is from the American College of Surgeons Committee on Trauma, and also a joint statement from the American College of Emergency Physicians. The paramedic flash card says it is it's going to be a dose of 0.5 to 2 milligrams per kilo. Now, obviously, that is a very wide range. Most call for a smaller range for pain management, such as 0.2 per kilo, sometimes 0.3 per kilo. And then when we talk about these out of control patients that you have to go hands-on, sedate them, normally IM in most cases. Where I work, it's 2 to 4 milligrams per kilo IM for that patient that is just out of control and uncontrollable. So let's talk about ketamine itself. Ketamine for pain management is great. It decreases the perception of pain in your brain. There's some really technical things that you can read about, but for our circumstances, I want to keep it easy to understand. Ketamine is somewhat of a disassociative. So it actually disassociates your brain with the ability to feel the pain. And there's also some other long-lasting effects with mental health that they don't remember the incident, they don't remember the pain, so that could be good for long-term recovery as well. But for pain management, let's just say broken leg, and we give them IV appropriate dose. It has minimal respiratory depression. Now, every person reacts different to pain medicine, so we want to obviously monitor their respiratory depression. But decreased respiratory depression compared to, say, an opiate or a benzodiazepine. Easy, safe drug. Now, we know ketamine gets a bad rap because the only time we ever hear about it in EMS news or in the national press is normally from a negative. So we want to make sure we're using the right dose, following our local protocols, and obviously doing it correctly. Now, when we talk about these out of control, aggressive patients that are just truly a danger to themselves or others, EMS providers, law enforcement, first responders, things like that. Now, a lot of times, again, when we get these calls, we kind of know ahead of time that this patient may be a little bit uncontrollable. So start thinking ahead. Okay, what is my dose? How big are they? Obviously, we might not know their weight, but maybe we can start thinking, okay, let's get my protocol book out, let's get my app out, let's get my my notes out of what I need to be doing. Now, if you have to call for orders, you call for orders. If you don't, obviously follow your local protocols. Now, don't forget, when we're talking IM injection, we have to get a needle and we have to go hands-on. So we have to do that properly. Now, a lot of times also, don't forget, most of us, 2 cc's was the max that we would give IM. So you may have to adjust that or have more than one syringe. Some protocols do allow to give greater than that in those very extreme cases, but obviously follow your local protocols. Now, ketamine given intramuscularly, obviously you want to get some big tissue, that big shoulders, those big thighs. If you had to use the buttocks, obviously that would be acceptable. But afterwards, you want to immediately roll them over if they're not already on their back. Use precautions as far as restraints if needed, and then monitor them. Get them on the EKG, get them on the pulse ox, get them on the end-tidal CO2, like a nasal capno. We want to obviously prevent any aspiration if they vomit. We want to maybe sit them up a little bit. Now, but again, if you just sedated this guy that was that out of control, took multiple people to hold him down, multiple law enforcement, fire, EMS, things like that, this patient is going to be very sedated in most cases. Now, obviously, everyone has a different reaction to ketamine, but in my experience, plane flying over, apologize. It's one of those things that they're pretty sedated, and yes, you may restrain them and God forbid they wake up, but get a pulse ox on them, get a good blood pressure, get a good respiratory rate, and then use that as a trend. Okay, where are we at post sedation? Are we going up? Are we going down? Also, if you notice maybe an uptick in the respiratory rate, your ketamine may be wearing off. Now, again, the ketamine dose sometimes gives a very broad range as dosing, but again, most people for pain management, it's that 0.2, 0.3 per kilo, 0.4 per kilo. Don't forget, when we get over that 0.4, that's where we get into that K-hole that people always talk about, where they get that emergent, when they wake up, they're out of control, or the K-hole, They have bad dreams, night terrors, things like that. So we want to stay on that low side for pain management, and that high 2 to 4 milligrams per kilo IM for those truly out of control aggressive patients. But as always, use your protocol. Post sedation, make sure that we're maintaining their airway, we're getting good blood pressures, we're getting good CO2 readings, good pulse oxes, and we're following our local protocols. Now don't forget, when you give that ketamine, whether you call for orders or whether you use the standing protocol, make sure you have that exact dose for the ER physician so they know exactly how much was given, and the timestamp is extremely important. As always, stay motivated, have a great day, and I'll talk to you soon.